It was a very successful Congress. Since last Congress in Vancouver, we tried hardly in order to organize something different in this year. First of all, to select the most open-minded, mainly young, successful cardiac surgeons from around the world to construct the society in a new schedule. And that was a reality at the end, because we had here many distinguished lecturers who gave lectures in a high level, and that was the first successful thing. The second one is that all these people is now the basis of the future of the society, and we can expect more. In my opinion, this was a Congress in which there was a revival of the world society, and I believe that in the future we will expand our efforts to other fields, like the humanitarian field, like the educational field, combined all of them with annual congresses as well at a high level. I believe towards society because this is the only one who can go everywhere, who can give the opportunity to developing or even to undeveloped countries to present their work, to give a podium to them, to present everything, and also to be a society in which people constructing it could be friends, cooperatives, and this atmosphere will be something important for this society. In an educational level, I believe that society, we will contract some postgraduate schools around the world in which distinguished members of the society will organize postgraduate courses or wet labs in order to present new innovations, new techniques, and that will be a reality in the near future. The other field is the humanitarian efforts of the society, because I believe there are countries which need not only educational help for the surgeons, but also surgeries for poor people, for children with congenital defects, and we will try to construct such a humanitarian program to help these countries. World society is the only one who can do that. No one in Europe, in States or in Asia. The world society has a universal character, and this role is for this society. When I started doing OPCAB revascularization, I believed that if you had to do that, we had to avoid any procedure in the ascending aorta. Therefore, I tried to find ways, doing pre-constructions or sequential grafting, to do the whole operation off-pump aorta non-touch using arterial grafts. And slowly we found that this technique was excellent. We avoided any stroke. We had just few complications, and the mortality rate was below 0.5%. That because of the technique. Applying this technique in high-risk cases, we found that we had the same excellent results in octogenarians, in diabetics, in renal insufficiency patients, and that push us to expand the technique and to try to teach other people and persuade other people as well to do the same. I believe that is a minimally invasive technique, even having a full sternotomy, but we avoid so many other things. The complications of extracorporeal circulation, the complications of touching the aorta, and that is something very important for coronary patients, especially for high-risk coronary patients. We started using stem cells, implanting them in the myocardium in 2005, and we have done almost 110 cases with low ejection fraction at the with end-stage ischemic cardiomyopathy, and we apply on them a triple technique. First, we revascularize the ischemic areas using the same technique. Second, we restore the shape of and the geometry of the heart, doing an external reshaping with superficial trio stitches. And third, we implant stem cells around the scar. We found that these patients suffer the operation much better. We haven't got difficulties during the perioperative period, as when we applied just revascularization of the heart. And second, we found that during the long period, these patients have a good quality of life with a small percentage of mortality because of cardiac reasons. Can you imagine that all these cases had to die during this 7 years, 8 years period, and now most of them are alive? No one other technique, even mechanical support or something else, can offer these results. I can't prove how stem cells works, but I can say, and I believe on that, that this triple intervention is safe and help patients to overcome the problems because of this end-stage ischemic cardiomyopathy. I believe that will be the future of our scientists, even from the side of the cardiac surgeons or the side of cardiologists. And we have to prepare the new generations to be educated and to be trained in these directions. Otherwise, it's impossible to be an isolated, for example, cardiac surgeon in the future. We have to cooperate with cardiologists, organizing heart teams, organizing common congresses in the future, and common training programs for young doctors, young cooperatives. And personally, I believe on that.